Welcome to the Genetic Disorder Research Project. For this assignment, you are going to fast forward 15 years into the future. You are a doctor. Your patient has chosen to have prenatal genetic testing done and discovers their child may be born with a genetic disorder. Your job is to guide them through what this means for their child and their family's future. To do this, you will create a comprehensive trifold display and deliver a 5 to 7 minute oral presentation. Because there is so much information to cover, your research and presentation will be divided into 4 distinct parts, requiring you to step into 3 different perspectives. Part 1 is the doctor's report. Speaking from the perspective of the physician, you will explain the disease upon diagnosis. You must cover the symptoms, treatment options like surgery or medication, and key statistics on how common it is. You also need to discuss if it is curable, ongoing research, and available technologies that assist in daily living. Part 2 is the genetic counselor's report. Here, you will explain how the disorder is inherited. Is it dominant or recessive? A gene or chromosome mutation? Autosomal or sex-linked? You must detail the specific genotypes the parents would need to have, the mathematical probability of passing it on, and visually demonstrate this using a Punnett square and a 3-generation family pedigree. Part 3 is the parent's report. Stepping into the shoes of an expecting parent, you will explore the deeply personal considerations of this diagnosis. You must outline the expected changes to your daily routine, home accommodations, estimated medical costs, and whether you might need to relocate for treatment. Most importantly, reflect on the emotional impact on your family and how society might treat your child. Part 4 covers community resources. You will provide a detailed directory of local and national support systems. This includes treatment centers, support groups, national foundations, special schools, and businesses offering financial assistance. You must include contact information for all organizations so the family knows exactly where to turn. For your display, your trifold must be neat, organized, and feature at least 6 relevant pictures. You also need a title page and an APA formatted citations page with a minimum of 5 reputable sources. At least one of these sources must be a non-website source, such as a published medical journal, book, or an interview. In addition to your board, you will present to the class for 5 to 7 minutes. You must clearly walk us through all 4 sections, specifically teaching the class how to read your Punnett square and pedigree. You must speak clearly, use accurate scientific vocabulary, and be prepared to answer at least one question from the audience. Now, let's talk about professionalism. You are researching real conditions that affect real families. This is not fictional. It is not entertainment. It is not something to joke about. Professionalism means using respectful language, avoiding stereotypes, and speaking with empathy. Imagine that a parent of a child with this condition is in the room while you present. Would your tone feel respectful? Would your explanation show care? Science without humanity is incomplete. Professionalism also means preparation. Stand confidently. Speak clearly. Use accurate scientific vocabulary. Stay within the time limit. If you rely on reading directly from your board, that suggests memorization, not mastery. Practice matters. This project is independent for a reason. Independent work means managing your time, meeting deadlines, conducting your own research, organizing your work carefully, and taking responsibility for quality. This is preparation for college-level expectations. Let's also address academic integrity clearly. Using AI or copying content and submitting it as your own is academic dishonesty. AI can help you brainstorm, clarify vocabulary, or organize ideas. But AI cannot replace your thinking. Your understanding must be real. Your research must be real. Your voice must be real. If you cannot explain what you wrote, that will be clear during your presentation. Academic integrity means writing in your own words, citing your sources, thinking critically, and demonstrating genuine understanding. Excellence in this project means deep research, accurate genetics, thoughtful reflection, real community resources, clear organization, professionalism, and confident delivery. Genetics is not just Punnett squares and vocabulary words. It shapes families. It shapes futures. Approach this project with care, with accuracy, and with integrity. I'm excited to see what you create.